Hi everyone, my name is Sky and my presentation is on ADHD, Attention Deficit Hyperactivity Disorder. We're going to start with the etiology of ADHD. According to Mayo Clinic, the cause of ADHD is not fully clear, but there is some constant research being done to find more answers. Some factors include genetics, the environment, or problems with the central nervous system at key moments in development. Brain anatomy and function can be a reasoning. Genes, toxins in the environment when the parent was pregnant. And some other causes could be that the child was born prematurely, or they have epilepsy or brain damage. Some characteristics in ADHD include short attention span, delayed language skills, delayed movement skills, delayed cognitive or learning skills, hyperactivity, being impulsive, inattentive behavior, disorganization, low frustration tolerance, and poor time management, and trouble multitasking. Some common symptoms in ADHD would include constant fidgeting, unable to concentrate on tasks, excessive physical movement, excessive talking, acting without thinking, interrupting conversations, little or no sense of danger, avoids or does not keep eye contact. On this slide, we're going to talk about the impact ADHD has on the child's development. In preschool, we see that they have high levels of activity. They're very hyperactive. Of course, hyperactivity will decrease with age, but in preschool, they do have short attention spans. School-age children, they're for sure going to have some academic difficulties and struggle with being disruptive in the classroom. School-age children with ADHD tend to be impaired in academic achievement, family interactions, and peer relationships, and elevated rates of psychiatric comorbidity. Adolescence and adulthood, the two most impacted areas are going to be the career and home life. With ADHD, we see adults struggle with inconsistent performance and missed opportunities to get promotions. At home, adults with ADHD struggle with being organized, and that might make significant others frustrated. Adults with ADHD can also struggle with other co-occurring issues such as depression, anxiety, and even substance abuse. So, how does ADHD affect the child's occupations? Well, social skills are definitely affected in school with their peers and even with their families at home. Depression, secondary to frustration, and difficulty with learning. Organization habits are affected when children with ADHD must do their homework or even their chores at home. Time management is affected when completing assignments in school as well. Some specific considerations for occupational therapy would be to maybe make a plan with the child and how to get organized in fixing their backpack for school every morning, and how to make their bed, and how to dress themselves. Because of hyperactivity and inattentiveness, it's going to be difficult, but I believe making a plan with the child that includes small achievable steps for them to follow would be beneficial for them to be able to do those activities of daily living. And it would really help their parents as well in the morning when getting them to school. Some other things that I think would be great to include would to not have quietness when the child is working on a task. I feel like a child with ADHD does not work well in quietness. I believe that if we include some white noise music in the background, that could help the child stay more focused and just more attentive. I think that some environmental modifications and activity adaptations to structure the child's environment at school and at the home could be very successful for them in just calming down and being more focused in what they need to do. I think in school practice, it's going to be really good to collaborate with individuals in education, the planning team members, and the parents. The parents, I think, is very important to get with so you could understand what they want for their child and what they wish their child can be successful in. I think training in social skills and self management will be very beneficial as well. Maybe using humor, personally, and initiated timeouts can improve adaptive behaviors as well.